REN2 is on the lower abdomen on the midline at the superior border of the symphysis pubis. So going down the lower abdomen using the side of your hand until you find the pubic bone. Looking at where the midline is on the body and marking your point on. Lung 11, it's at the radial nail point of the thumb. So in order to find that point, I'm going to look at where the proximal and radial borders of the nail meet. I'm going to look at the nail bed, feel for where the flare of the bone is, and put my point in.
Sanjiao points on the forearm are best located with the arm laying flat on the bed and the elbow turned outwards. To find Sanjiao 5, come 2 sun proximal to Sanjiao 4, in between the radius and the ulna. You should be on the radial side of the tendon of extensor digitorum communis. If the person wiggles their fingers, this tendon will come into relief. Large intestine 11 is located at the midpoint between lung 5 and the prominence of the lateral epicondyle of the humerus. Typically, this is at the end of the transverse cubital crease when the arm is fully flexed. Bladder 40 is located at the midpoint of the popliteal crease, in between the tendons biceps femoris and semitendinosus. To bring these tendons into relief, get the person to take the weight of their own leg. It then becomes quite easy to feel these 2 tendons. It's also easier to see where the popliteal crease lies. When they lower the leg, make sure you mark this point directly in the centre of the popliteal crease. Stomach 36 is located approximately 13 sun superior to the prominence of the lateral malleolus on the anterior border of tibialis anterior. The easiest way to find it is to palpate down the tibial tuberosity. Find the base of the tibial tuberosity and move slightly laterally until you fall into a nice dip on the anterior border of tibialis anterior. This point is also 3 sun inferior to the inferior border of the patella. Spleen 2 is located in a depression which is distal and inferior to the first metatarsophalangeal joint. See the knuckle of the big toe, come distal and inferior and tuck your point into the flesh at the flare of the base of the proximal phalange. Kidney 6 is located 1 sun directly inferior to the prominence of the medial malleolus. Palpate down 1 sun and feel for a cleft in between 2 tendons. Kidney 6 lies in that cleft. A common mistake is to palpate down only half a sun and to try to locate this point in the ankle joint. It's not in the ankle joint, it's in the cleft between the 2 tendons that are inferior to it. Liver 10 is located 3 directly inferior to stomach 30 on the anterior border of the muscle adductor longus.